talk a little bit about some of the machines that we can be put through during a diagnostic process to figure out where pain is coming from. The first thing I want you to know is your pain is always real, and it's always wherever you say it is. So just because something's not found in these scans doesn't make your pain any less real. Your pain is real, and you wouldn't be seeking a medical professional to try to help you out if it weren't. So please remember that no matter what your results are. Usually when we head to the doctor, the first thing we get for back pain or SI pain, which I realize is a little bit more butt pain than back pain, but it is still classified as back pain. So don't be confused when your providers write down things like, he or she has low back pain. SI pain does fit into the category of low back pain. But usually the first thing they want to do is they want to put you through an x-ray. Make sure nothing's broken, nothing's fractured, nothing's missing. And those scans usually come back pretty clear. If not, there's a fracture and somebody can do something about that. So great news. Either way, generally, when the x-ray comes back and you're still in pain, the next thing that the provider wants to do is put you through some kind of machine that will take a look at your soft tissue, either MRI or CT scan, with or without contrast, depending on your doctor. None of those are more right than the other. It's really doctor's preference. But we're looking at more structures with an MRI or a CT scan. And generally those come back pretty unremarkable with low back and SI pain. And the thing is, that's what you want to hear. You want an unremarkable scan. Oftentimes there's reports about some disc degeneration or a little bit of nerve impingement or disc bulges. And I want to let you know something a little crazy, but that's part of aging. So if the studies that are out in recent years show that if we take 100 people between the ages of 20 and 90 and put them through an MRI machine, and they don't hurt. So these people that we're sticking through the machine don't hurt. We're gonna find disc bulges and annular tears and nerve impingement and degenerative disc disease. I'm still not sure why they use that term, but we're going to find all those things in our non-painful counterparts as well. So that's encouragement to you that just because those things are there or they've been identified, it doesn't mean that you have to have pain. Now, that's not to say they can't cause pain, but they do cause pain in a very predictable pattern. And your doctors and physical therapists will know all about those things, and you can look them up if you choose to Google myotome, which would be muscle weakness in the patterns of the disc levels, or dermatomes, which is skin sensation in those same disc levels. So if you're curious and you feel like maybe you're not really sure about the information you're getting, those are things that you can Google and see whether or not your presentation actually fits the level of disc that they said there's degeneration at. I'll also let you know, by the time we are in our 30s and 40s, most of us that move at all are showing degeneration at L4-5 and L5-S1. Those are the two lumbar discs that move the most when we move, so they get wear and tear. Doesn't mean there's going to be pain, just means that that's really, really common in findings on these scans. So the good news is, if you've made it through an x-ray and you've made it through an MRI, you are the proud owner of non-specific low back pain that happens to be showing up in your SI joint. It's a bummer, and it hurts, and it is definitely getting in the way of you living the way that you want. But the good news is it can be solved. And the general solutions are finding movement that doesn't increase your pain more, learning some things about what causes pain in addition to your tissues. Things like stress, job, nutrition, quality of sleep, movement and exercise. all of these things feed into the brain processing whether or not we are going to experience pain. If you'd like to know more information about that, why don't you join me over at my website, restoringvenus.com. And I've got some posts that you can search for, as well as information that I'm going to keep putting out. And you can always contact me for a consult, or just Facebook message me and we can talk and see if we can get you moving beyond your pain. Hope this was helpful. We'll talk to you soon. Bye-bye.